The Department of Public Health and Social Services is continuing to take proactive measures in ensuring the swine flu is controlled on the island. Director J. Peter Roberto says officials have been busy meeting and preparing for not only the upcoming Guam H1N1 summit in August, but staying a few steps ahead.
So there's a lot of activity going on in pressing the shared responsibility message, and I'm really glad that obviously people are calling, people are reading, and people are understanding that there's a lot of things that they can do now to take care of themselves.
Roberto also says they are working with the Department of Education to prepare for the virus spreading in the schools. Guam Education Board Chair Joe San Agustin says DOE is on red alert to inform its 4,000 employees and 30,000 school children how to be proactive. He mentions that Superintendent Dr. Narissa Underwood is also meeting with her management team on the matter.
And they're going to discuss on the being not only reactive but proactive. Number one, educate the staff and faculty about the swine flu, what's going on, what measures they need to take, to personal hygiene and stuff like that. And they're going to have Mr. Scambaluri, who's the guy in charge of business, identify the funding source so they can buy the additional hand sanitizer, make sure there's adequate number of paper towels, soap for the soap dispensers, for the students and for everybody.
Roberto says shared responsibility is important, so while health facilities like Seventh-day Adventist Clinic are taking proactive measures to combat the spread of H1N1, Roberto adds everyone else should do the same.
The underlying message here is that if we remain and continue to follow our plans, and be cautious that, in fact, that if you do have individual family members who are have medical conditions like, heart disease or upper respiratory problems, asthma, and other medical underlying conditions, and they do get ill and do have symptoms of the flu, that they do call their doctor.